Hello and welcome, and thank you for joining us today at this Place Northwest Roundtable. I'm so excited because we're going to be discussing the business case for innovation at healthcare estates. Let's start things off by establishing where healthcare estates are today and the challenges that they're facing. Guy, why don't you sound off on that one?
Thank you. Well, the estates are facing a serious challenge. I think the King's Fund had quite an interesting bit of analysis that at the end of 2020, there was £9 billion worth of backlog maintenance alone. So that's even before any new development or reorganising any of the estates, which is a significant amount of money and work to do by any stretch of anybody's imagination. So we're fully aware of the sort of 48 hospitals, even though I think 8 of those are really existing ones under development and delivery. So there's sort of significant issues then for how new hospitals get planned and redeveloped. So that will deal with a bit of that backlog, some of those issues, but then there's the retaining estate and the rest of the hospitals that won't be getting that investment and how they deal with it.
As an architect, as a town planner, as a builder, you're only building what you should only be building. What the system is telling you it needs. And so are we clear on kind of what that is as a starting point in terms of hopefully we get this significant investment through the new hospitals programme, but what should we be building with that to make it, the right thing for our communities and that it's sustainable and flexible. One of the sort of tenets of what we're trying to do at MFT is that, traditionally perhaps NHS estates has been seen as a bit of an island, and it is just that kind of outward facing bit as well, and a hospital's not just somewhere you should come when you're poorly, but actually what else can we do as anchor organisations in a community to add value more and reach out to the community. So that's a big theme running through our proposals as well.
We feel that that social care becoming more and more an integral and important part of the whole system. But we've on a number of occasions looked at healthcare estates, and there's a lot of spare land. There's land that could be utilised not just for healthcare, but for peripheral but linked issues such as healthcare, hotels, training centres, social care centres, and so on. And that in the process of, maybe it's not the right word to use, but creating some kind of healthcare village or a hub for the community.
It's about making sure you've got a master plan and you're looking at this in a holistic way, and that you're looking at the assets. Which assets can be reused? Is it cheap to refurbish them? Do we need to knock it down? Do we need a new building? What is the new building? Some of these estates are so big that they could almost become their own, as we call it, the 15-minute town or the 15-minute city, where we look at all these different things. So you get people that live there, you might have a place of work, you've got your healthcare, is it close to a school, public transport, parkland? I think we just need to look at it in a holistic way.
If we look across a lot of just hospitals, somewhere between 30 and 35% of the space is admin space. And yet, so we're building, and we know that the cost of building hospitals is £6,000 to £8,000 a metre, depending where you are. And we all know that we can put office spaces into buildings at half that cost. And yet consistently there's resistance. Again, it's just cultural. And part of it is because staff are being cramped into tiny little booths, sometimes almost sort of back of tiny little sort of booths and stuff. If we can show them that we can build high quality office type elements, either on the edge of sites or indeed in some cases off site, then we can again slim down the amount of space on hospitals, which makes it easier to redevelop, makes it easier to release space. And it's also, in terms of, again, the whole issue of sustainability, a better place to do than sticking gas and air right through 100% of a building that doesn't need it.
In terms of efficiency, I think it's about almost making the hospital as small as it can be. It has to have the capacity, but it's a very expensive building, isn't it? It's engineered to the hilt as it needs to be, and it's it's power hungry and everything else. So actually, it is focusing down on what should be in the hospital building itself, and what else is in our master plan. And we have a health and wellbeing hub within the North Manchester master plan, which is a separate building, more open to the community, sits in the middle of this new healthy neighbourhood that we're proposing, and becomes part of the community, somewhere people feel much more comfortable walking through the door on a day-to-day basis.
So kind of taking that into consideration, what are some of those big ideas we can be doing with healthcare estates?
Yeah, I mean, we've looked at 2 or 3 sites to try and get healthcare hotels going, and as Connor will tell us, almost every country in Europe other than the UK has hotels linked to hospitals, where the hotel is there to provide bed space for people who no longer need to be in primary healthcare facility, i.e. in the hospital, but also providing bed space for friends and families, for key workers, late shift workers, all that sort of stuff. It just seems that there is land. We know there is land. Leon knows there's land there that could be used for this sort of thing.
I mean, the number of new students now, or the demand for more doctors, nurses, etc., is quite large. And working with Chesterfield Royal Hospital, they're expecting student numbers to double in the next 3 years. So how does that actually get accommodated, both in training facilities across the trust, in the trust, and then also where are they going to stay? So there's an increasing and ongoing demand there, which I'm sure Michelle's come across with Manchester. Obviously got these links anyway, but other trusts don't.
Yeah, absolutely. Bringing in training into our plans and thinking more widely in terms of how to get more local people through the doors, and not just clinical, but all the stuff that people don't necessarily think of. So, cooks and plumbers and, all our estate staff. So, there's a massive opportunity, I think, there. Another one for us is research and innovation, and how you can, which is a huge growth sector. It is in Manchester, and it's something we want to help. We started it with City Labs 1, and we've now on City Labs 3. QIAGEN just literally moving in the next few weeks to our new building on Oxford Road. So how can we continue to work in partnership with the research and innovation sector for mutual benefit?
I think to come back to the point, it's about connectivity and making sure that the estate appeals to a wider range of people as possible, young and old businesses. Michelle touched on, there's a load of businesses affiliated with the hospitals that you wouldn't even dream of that might want to take some space quite close. Is it bed linen or whatever it can be? There's hundreds. I think it's just going in with your eyes open and really trying to think outside the box and making sure that you look at a holistic master plan and don't be shy. Don't think, we can't have an office here because it's a hospital site, or we can't have residential here because it's a hospital site. Hospitals are great places, sat on great assets, great pieces of land, great locations, ticks a lot of boxes for a lot of people. So I think it's really worth having a really good look at, but it's got to be long-term master plan, joined up thinking, and a holistic approach, which gives you a resilient estate.
Thank you all so much for joining us. I hope you enjoyed yourselves, and thank you to everyone who's going to be watching this later. Hope you learned a lot. I know I did. I also want to make sure I thank the Manser Practice again for sponsoring this roundtable. I think it's really given us a lot of food for thought, basically, about what we can be doing with healthcare estates and the obstacles they face, but the ways that and how important it is that we overcome those to really deliver healthcare estates for the future, basically. So thank you all again so much for joining, and have a good rest of your day.
Thank you.
Okay.
Thanks.
Okay.
Thanks.